Welcome to Think Like a Pancreas, the podcast. Our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in the program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Since this is a very individualized condition, please check with your healthcare provider before implementing any of the weird stuff we may happen to share with you today. I'm your host, Gary Scheiner, owner and clinical director of Integrated Diabetes Services. And today I have the unique pleasure of being joined by Tavia Vital, who is, what's your title with the practice? I forget.
Director of Intensive Diabetes Management.
There you go. We always come up with
really great titles.
Yeah, you wanted to be like Grand Poobah, Queen of the World, but that was taken, so we had to come up with
something else. Yeah.
So you are from DeWitt, Iowa.
Yes.
And I looked on the map, and it's nestled between Davenport and Dubuque, Iowa.
Yep.
They name all the towns with D's along the eastern border of Iowa.
Many of them are named after explorers that came through once upon a time. So if you look across the US, there are about 10 different DeWitts. There are at least 3 that I know of that pop up quite right away when you look.
So there was a Dubuque and a Davenport also that...
There are some around.
Okay. Yep. What's it like living in, it's a small town. I looked up the Dairy Queen there. That was about it. What's it like living in a really small town?
One thing that is good about living in a relatively small town is there aren't as many things to worry about as far as safety concerns as compared to a larger city. One other thing is, as long as the planes are not spraying pesticides currently on the fields nearby, the air is amazing. You go outside, you breathe in, you do not smell exhaust typically. And traffic, there's not really traffic. When there is traffic that we're annoyed with, it's because a football game got out or some other, it's a play just finished and all the cars are emptying out of the school parking lot. So it's a couple of minutes, that's traffic.
How many traffic lights do you have in DeWitt?
4, if we count the ones that are on the edge of town. We have an extra one right now, though, because there's some construction on a bridge, so they put a temporary light in.
The fact that you can count them tells me everything I need to know.
I might be shorting a couple of them, but 4 popped that I can think of right now. Yeah.
Yeah, I always fancied that if I didn't work in diabetes, I might be a good traffic engineer. And there's a lot of traffic lights I'd like to do away with because they're just superfluous and unnecessary.
Like, why do you need them in every block?
Yeah,
that doesn't make any sense to me.
You don't. So you've been worked in the diabetes field for a while. What was your impetus to work in diabetes?
My long-standing love-hate relationship with my diabetes, basically. That's where it came from. So since I've lived with type 1 for I'm at the 43-year mark now. Great. Yeah, I guess. And I had already gone to college and was working in the business industry and long since had decided I really enjoy helping people. I like helping people solve problems. I like helping people figure out they have this, they need this, how do they get from here to there? But I didn't really care if I helped people with their business problems. I felt like, okay, we solved it. But I went to a diabetes education class because my new endo, when I moved to Colorado, they required it to come see an endo. You had to take their diabetes education classes. At that time, I had had type 1 diabetes for more than 25 years. So I was a little annoyed thinking, what do I have to go to a class for? What am I going to learn? I learned things. It was eye-opening. I learned how to treat a low glucose. Sounds wild, but I never really thought about how much does my glucose go up when you treat a low? What am I trying to accomplish other than not dying, right? It was just mind-boggling, little details.
So my approach of just keep forcing food in your face till you feel better, that is not optimal?
That's not the ideal way. It is an option, but optimal, no.
It feels good, though.
For the moment.
For the moment.
And there's the next few hours. Yeah. And there was a diabetes educator teaching the class. She had type 1 diabetes, and a little light bulb went on. I could do that. This would be great. I could talk to people about diabetes. They would understand what I'm saying. How exciting. Could be in an office full of people who care about people with type 1 diabebees.
Yeah. Yeah, we
That
have
was
that
it.
in common because I was sort of floundering after undergraduate college. I was working in advertising and marketing, and it wasn't really satisfying personally. And then I went to a hospital program where there was an exercise physiologist doing a talk, and I learned so much from him. And I looked at him and I said, that's what I want to do. I developed my passion for it just from hearing someone else
Yep.
and their passion for it.
Yep. It was
Yeah.
that.
So we're gonna have to change the title on your cards to the diabetes fixer because you're really good at solving problems.
Maybe the diabetes detective. I don't like to fix things. I like to help people explore so that they can fix it.
See,
Me fixing it does no good.
that's a true male-female difference, really, because as
Yeah.
guys, we love to fix things.
Yes.
Fix it, forget about it, we're done, put it away. But women like to investigate, think about it.
I can tell people what to do, but a lot of time I don't like it if you tell me what to do. Even if it's a great idea, I might just shoot it down for the sake of, because you told me. You're not the boss of me.
So if
So
you share
I don't do that.
you share a challenge you're having with your husband, you want him to just hear you and listen to you. And what does he want to do? He wants to figure it out. Well, here's all you have to do. Just do that, right?
Right. Yeah, that's true. That's a natural thing. So we talk to our girlfriends when we want somebody to go through it with us. If we really are like sick to death of this thing, then we tell our spouse and then they can just give us the answer and we move on. It seems logical.
So we're basically the last resort.
No, that's where if we're really ready to take action.
Oh, I see. It's different stages like contemplation and all that.
Right.
Got it.
Like my pants are getting a little tight and I feel like I should start exercising more and maybe eating more healthy and maybe cutting down on the amount of creamer I put in my coffee because I like creamer. I like a little coffee with my creamer, right? But I may not be ready to execute on any of those. So if I asked my husband, he'd be like, well, you stopped doing your morning walk a while ago. Why don't you just do that? Okay, yes, I could. So yeah.
So, or I would say just buy bigger pants and don't worry about it.
Right. No.
Solutions, there's different solutions.
Yeah.
So besides your diabetes, you have more diabetes in your family, right?
I sure do. So we have two kids and they were involved in research studies since they were newborns. We actually took cord blood. I didn't, a nurse did and put it into a test tube. And they've been enrolled in diabetes related research throughout their infanthood and childhood. So my oldest is now 16 and he was diagnosed in May of 2020. Very common, is a common diabetes anniversary with many people. May of 2020 at age 12. Yeah.
Okay. Yeah, 12 is a pretty common age for diagnosis. All those
And
puberty
during
hormones
COVID,
kick in and create insulin resistance. It just makes the pancreas work that much harder.
yeah.
Yeah. So has your other son been screened for diabetes?
Yeah, he's been screened. At some point in time, he put his foot down and said, stop poking me with needles. So he has not recently been screened. We're working on talking him into, maybe we'll do the finger poke screen this time instead. We'll see.
Yeah. Barbara Davis Center actually developed some best practice guidelines for how often people need to be rechecked. And you may not have to do it every year.
Yeah.
If somebody doesn't have any antibodies, they usually say, you could probably wait. If it's a child, you can wait at least a couple of years before checking again. Adults, it can be every 5 years or just one time only might do it. So just for the benefit of our listening audience here, all two people that might be listening, what's the benefit of screening somebody who's at high risk for type 1 diabetes?
There are a few benefits. In our case, I wanted to be aware of the subtle changes that were taking place because there were a few other research studies that my son may have been able to qualify for that were testing out the efficacy of other medications at shutting down that autoimmune process. So it could either halt the type 1 diabetes where it was and not let it progress rapidly or reverse it. so that he could keep making his own insulin, or at least make some insulin, which is always very helpful when you're trying to live a long, healthy life without as much amazing ability to fluctuate blood sugars astoundingly. And it also helps protect against long-term complications if you have some insulin production. So knowing this, that was one key reason that I wanted to keep in these screening programs. And then the other is for people who may not have the experience of a surprise diabetes diagnosis that typically is diagnosed when someone goes into diabetic ketoacidosis, DKA, which typically is very scary as a parent, seeing your child, or even as an adult, was healthy, all of a sudden super sick in the ER, can be life-threatening. It's a terrible thing to have to go through. So the studies have shown that if you're screening, then kids that are screened are far less likely to experience life-threatening or serious DKA. You catch the diabetes diagnosis much sooner. You can start insulin sooner, which is what the body needs to thrive and be healthy. So it's a better option for health and for mental sanity and the experience of the family.
Yeah, they keep finding new and more, effective ways to delay the development of type 1 or the progression. Because it doesn't just pop up all of a sudden. You have the antibodies, and then there has to be a phase of beta cell destruction, and then the glucose levels become abnormal, and then the type 1 develops, or it's diagnosed. And catching it, like you said, catching it early helps preserve beta cell function.
Yeah.
They're finding more and more ways we can slow down the progression and detect it very early. Tzield, teplizumab, can be infused intravenously for a couple of weeks, and that delays an average of about 2.5 years, the progression. But there's a lot of stuff. Anything that eases the workload on the pancreas seems to be beneficial. So we can learn from our brothers and sisters with type 2 about how to do that.
Yep. And anything that eases metabolic distress is what I like to call it. So anything that helps your body be more healthy, less insulin resistant, less cancer causing, less inflammatory causing, those types of lifestyle pieces and supplements, getting sleep, getting exercise, not smoking, stress reduction, all the things that we know help make us healthy, slow that progress and are important.
You got that nursing background that helps you integrate a lot of the physiology into your patient care. Now, you didn't go to nursing school in Iowa, though. You were out in was it Denver?
Colorado? Yep. Yeah, I was in Colorado when I went to nursing school.
What was that experience like, going out to Denver, the big city?
Oh, it was great. Yeah. So at the time I plotted on a map, here are the places I want to go live. And then we selected one, moved, and that was that. And I was working, I got a job as a medical secretary. It was my first hospital related job. I worked in a business environment first, and then shortly after arriving in Denver, then I got the medical secretary job. And then I interacted with an endocrinologist who was the director of the adult medical research unit that I was working on. And then I got into nursing school. It was accelerated, so I worked full time. Our classes were on Fridays. It was a very small group of people. We went through 4 years of nursing school in 3 years with classes only on Fridays, clinicals 12 hours on the weekends once we got to the clinical part. So
I am not surprised to hear that you got through a 4-year program in 3. Because honestly, you are maybe the most organized person I've ever met. Besides being a problem solver, you are extremely organized about things. And it definitely helps when you're living with diabetes, but it also helps when you're coaching and teaching patients about their diabetes management as well.
Yeah.
You also have a background in Spanish. Is that from your upbringing, or is that purely through your own study?
That's through my own studying. I love languages. So when I went to college the first time in Iowa, I studied business and languages. I studied Spanish, Portuguese, German, and Chinese. And I only minimally remember how to say a few things in most of those languages. But Spanish, I had the most experience with. I can practice it the most and use it the most. So yeah.
Wow. With all those languages, I was just thinking that could really open up some major markets for us.
It would not be good. I can count up to a certain number and ask how you are and say what my name is. But if you try to tell me about your life.
Okay, so I'm going to test you. Can you say, hi, my name is Tavia in Chinese?
Oh, I probably, okay. But if anybody speaks Chinese natively, don't turn off the podcast because my
here's
accent is
Tavia's
terrible.
phone number. Call her to complain.
No, I don't even, my accent would be awful because it's very complicated
All right,
language
let's hear.
to get right. Let's see. Ni hao, wo shuo, Tavia.
All right. Well, the Tavia part, I think you got right. Who knows?
That part I got. Yeah, the rest of it.
That's impressive. So, the Spanish part, you really took to a high level. You're a certified medical interpreter in the Spanish language. That can't be easy to do. You got to know all the nomenclatures and whatnot. So how are you applying your Spanish skills in your career now?
Now I get this great opportunity to work with Spanish speaking families and people who live with type 1 diabetes, and we have a consult so I can do them entirely in Spanish. And it's great because anything that you might be nervous or stressed about or that's really important to you, it's better if you can communicate in your primary language. Even if you're completely fluent in another language, it sinks in better. It makes more sense. You can calm down anxiety better in your own language. Even like I said, even if you're fluent in another language. So yeah, it's a great opportunity for me. I'm really pleased to be able to work with the number of Spanish speaking families that I am working with currently. It's my favorite thing, really.
Yeah. It makes a difference because it's not readily available, at least for people with type 1 needing specialized help. There's not specific Spanish service in most places. I know you work with a lot of people in Panama. You want to do a shout out to any of your special friends and colleagues in Panama?
Oh, I better not, because what if I forget somebody's name? But I could say a shout out to the Baker family because I work with the mom, Pilar Gomez. She runs a foundation for Spanish speaking individuals from Latino America, especially Central and South America focused, and provides a lot of great educational opportunities and social bonding for kids and adults with type 1. And we work together on many projects along the way. And I'm super grateful for her insight and information. And she has children with type 1 diabetes and she lets me help them manage it. And so it's a great, she said I'm part of their family, for better or for worse. They've adopted me. So that's good. Good for me.
That's a nice family to be part of.
Yeah, it is. They're great. Just a great family.
Yeah, I mean, our practice, we work with clients all over the world, and it's interesting to learn about the health systems in different countries. In some ways, I'm jealous of the situation that some people are in, but I'm also I feel a little bad about some of the limitations we see in other countries. And you deal a lot with people in South America, Central America. Where do you see they have either advantages or disadvantages from a healthcare standpoint?
Each country is different with how it operates, which is an interesting thing because if you look at it on a map, you sort of think South America must be like the United States. No, it's a bunch of countries individually operating in their own underneath their own government systems. So every country has its own carve out with what public aid covers. If there's a privatized insurance versus the public health insurance, and there are different doctors and hospitals and different supplies are covered or not covered. So it varies wildly what people have access to financially, depending on where they live. And then physically, so let's say you live in country X and you want pump A, you may not be able to physically purchase it in your country. You might have to travel to other countries or go to the United States and have it prescribed and then get it shipped to you and then fly back home. And then if you think about every 3 months, you need more supplies. That's an ongoing challenge to many people living around the world. Yeah. And even the insulins, there is a type of rapid acting insulin in every country that I'm aware of in Central and South America, but there may only be one type.
Yeah. And the ultra rapids haven't made it to every country either.
Definitely not. Yeah.
Well, I just got a package in the mail today. It's my Afrezza starter kit. I mean, I've tried inhaled insulin before. I'm going to give it at least a couple of weeks and use it exclusively as my mealtime insulin and see how it goes. And then hopefully my Mobi pump will show up soon. I'll be able to give that a try, and I'll use a Libre sensor with it. So we
tried all kinds of things.
We try all kinds of stuff.
What can go wrong?
What are you using today for your
Today I am using an old Omnipod pod, the Eros version, with a Riley Link radio transmitter, and I'm using Trio, which is more people have heard of do-it-yourself Loop, open source coding Loop. I'm beta testing Loop with several people on our team, actually. And one of our team members is actively involved in the development and ongoing instructional documentation and usability of Trio.
Yeah, it's nothing like personal experience with these devices and systems. I feel like it gives us a better feel for how to make them work well, and this stuff that's just not in the user guide and the manual that you learn just from actually wearing it and using it day in and day out.
Right. So when people have questions or they have trouble with it, if you've worn it enough, then you probably experience that, or you could at least understand what their specific issue might be and guide them to the right section of the menu, or explain how the device works. How's the algorithm work? What is the button pushing involved that creates that error every 10 seconds? If you do the buttons this way, you won't have that problem, whatever it is. Yeah.
Even with CGMs, we've got patients who have trouble wearing the CGM and the quote unquote approved body parts. And we're able to give them some insight about where it might stick better, where it won't get knocked around as much, where it'll still perform really well, just from personal experience.
Yeah, for sure. Yeah. And then if somebody says it's not working the way that they market it to work, you have personal experience. So you could, whether it's through ourselves or through our clients that tell us, their experience, and we see it on graphs on the screen, then at least I think a big part of what we do is validate people's experiences, where sometimes they try, I'll call customer service for the company that their device is through and maybe not be met with ideal responses, or their doctor's office, maybe their provider office doesn't have somebody who's tried all these devices out. And so they really can't empathize, and they can't really understand what the person is experiencing. And so I think that's one thing we get a lot of feedback from our clients is, thank you, I feel validated. I just got one of those messages from a mom in Panama this week, in fact.
Yeah. No, you got a lot of diverse skills. I mean, you've got some tremendous expertise in Spanish and issues facing Spanish-speaking users. You've got experience with every pump and CGM, and now with the open source, the DIY type systems. And I guess having a son with type 1 gives you a unique perspective about working with families that have kids with type 1.
Yeah, it does.
So what are some of the specific or other areas that you can provide service for clients?
One area that I love is working with moms that are planning pregnancy or who are pregnant, to help them navigate the expectations and all the ongoing changes that are needed to insulin dosing, but also where to wear your pump, or other issues that come up because of skin integrity throughout pregnancy. And just I've been there. I've had 2 healthy children while living with type 1 diabetes. So when they come on and have their anxieties or the things they're most concerned about, I understand what they're saying. And I love being able to give them information that helps them understand their concerns and strategize, so that the concerns aren't what drives every day of their life. They don't have to go through pregnancy super anxious the whole time. Instead, we can focus on healthy pregnancy.
Yeah, you and Jenny Smith are our dynamic duo in terms of working with women who are hoping to have a healthy, successful pregnancy, and our success rate is off the charts. I think we do better help more women have successful pregnancies percentage wise than any place else I've ever seen. And it comes from
I got pictures this week. It was yes. What day is today? I don't even know what day it is. Is it Monday? Every day runs into the next. It was last week. I got pictures last week from a new baby that I helped the mom with through her pregnancy. It's so exciting. Super healthy
great feeling.
Just the right size. No, they didn't need the ICU. They didn't need any of those things. Healthy mom and baby. So exciting. Yeah.
That's nice. Yeah. And you've sort of co-managed not really a support network, but kind of a support network for parents of kids with type 1. Tell us a little about that.
Yeah, sure. So one thing that many of us have noticed along the way working with parents of kids with type 1 diabetes is just the overall intensity of managing a child's diabetes. When it's your own diabetes, that's one level of intensity that can exist, but it's your child. Parents, we want the best for our children. We want them to be healthy. Sometimes we go about that looking at all possible healthy options and choosing and navigating through, making mistakes, learning. Sometimes, though, we get so concerned that we stop using strategies and we start basing everything off of anxiety-based decisions, and it's all-encompassing. Parents will often, it's really common for parents to feel like, I don't do anything other than what I have to get done in the day and my child's type 1 diabetes. I'm not sleeping, I'm not talking to friends, I'm not going out, I'm not, it's just very, very intense for them. And so helping parents find a place where other parents are going through the same thing so they can interact with each other socially, but also providing information about coping skills and how to let go a little bit, not let go of helping your child be healthy, but switching from anxiety or intense guilt or worry focused decision making to here's the issue, here's the thing we're planning for, what are the steps I need to do to ensure we're as successful as possible. If it doesn't go well, I know what to do to help my child be healthy in the event of a higher or low blood sugar. And just taking that emotional burden down a few notches. So we created, I was gonna say think like a pancreas, but that's what you created. Time Out for Caregivers is the name of the sessions that we created, so people can come together about once a month or once every other month and join in on our conversation. We have it co-led right now with Anna Savino, one of our licensed social workers who specializes in working with kids and parents and people living with type 1 diabetes and the emotional burden that it can entail. So she and I run it, and it's a great opportunity for people to feel that kind of stress decompression. Yeah.
How do you feel when you're running those programs? Do you feel it's a good catharsis for you as well?
It really is. It surprised me when we started it. I thought, well, this will be great for the parents. And then as they were telling their stories, and I realized like, oh yeah, I didn't sleep for the last 2 nights well because my son's alarms were going off and I need to change his pump settings. Like, oh yeah, okay. We're speaking the same language. It's great. Yeah.
Yeah. I've always felt that parenting a child with diabetes is 10 times harder than living it with it yourself. And if you or I, if we have a high or low glucose, we're like, yeah, screw it, move on. When your child has those issues, we internalize it and we feel guilty and we dwell on it, and it's a big issue.
Yeah.
So yeah, I guess helping parents relax, put things in perspective a little bit can make a big difference in the quality of life.
Yeah. And just having, most parents are doing this on their own because they don't live in a place where all of their friends' children have type 1 diabetes. So they don't have someone that they can just readily talk to about a frustration or just all of the things that make up dealing with a child's type 1 diabetes. Just being able to bounce those things around and hearing other people going through their experiences is just super, just emotionally, but also there's like a physical release. A lot of people cry, like they're like, I'm not even a crier, I don't even know why I'm crying. It's because you feel validated, you feel you're not the only one, because you're not.
It's good to get
that.
Yeah. Yeah. So thinking again about the life of Tavia and being in the middle of DeWitt, Iowa. I know you've got cornfields in sight, and I expected you to have like a hen house and cows, and but you've got other pets. Tell us about your dogs.
We have my husband and sons and I have a husky. His name's Cisco, and he's amazing. He's usually in here. He's not in here today, but he will be later, I'm sure. So he's a lot of fun. He has lots of energy. Thankfully, he also sleeps a lot, so that kind of balances out. So yeah. And then we built a 2-family home to help with caregiving for my parents. And my mom has 2 Chihuahuas. So I think one of them was barking earlier. You probably heard her. It's Chica. And so there are lots of lots of dog hair in my house that we are perpetually cleaning up. Yeah. We used to have birds as pets, but they are very noisy and you have to do a lot of cleaning and they require a lot of focus and energy. And we started helping caregive for my stepdad, and we gave them to a nice woman who is retired and gets to play with them all the time. So there's less zoo-like noises in our home now than ever before.
Yeah. Well, and it's nice that you thought about your family and your parents and your in-laws and all, and your kids can grow up, being really close to the extended family that way.
Yeah.
Does it create any challenges for you having them in the same house or the same structure?
Of course. I mean, imagine living with any of, parents or in-laws all the time.
I try not to think about that.
So it doesn't matter how great of people you are. If you live with someone else, there are moments where it doesn't go as well as you'd like. But overall, I mean, we built the house so that it's really 2 homes in one. So we go into our living area. My mom is in her living area now, and it's pretty. I'm pretty chill anyway. It takes a lot to get me all riled up about something. So I don't
Add
know.
patience to your growing list of skill sets.
If my mom decided to talk to me in her "I'm your mom, you're a teenager" voice, we would have to talk about that and change that. But she doesn't. So and if she does,
maybe a
I
skill
remind her.
set we got to add. So patience, but also steel drums. You played steel drums
Drums,
back in school.
marimba, percussion. So in high school, I played percussion. I really like mallet instruments like marimba, xylophone, bells, and I played steel drums in college. Yeah, I wish I had them in our house right now, but I guess it's one less thing to distract me from when I need to be concentrating. So yeah.
It's a magical sound because everyone just thinks about a tropical island. The
Absolutely.
stress level goes down when you hear a steel drum.
Yeah, that's where I'm physically in Iowa, but I'm mentally by an ocean somewhere. Do you see the turquoise kind of sea colored things I have going on? My wall is a light kind of horizon sort of blue. Yeah.
I looked at the map and I think DeWitt, Iowa is as far from any ocean as a human being can possibly get.
Pretty much, yeah. About as far as you could be. It's very close to many lakes and ponds and
a
really
kiddie
big
pool
river
in the backyard.
We do, yeah. That was an amazing thing. So can swim and pretend it's the ocean.
Pretend.
Yep.
And you're into kayaking, right?
Yeah, we went last week. We went kayaking, and so we either part of the family goes, or if we all go, then 2 of us walk and hike around while 2 of us kayak, and then we trade places, and it's a lot of fun. It's great because I had hand surgery not long ago and it's healed enough so I could kayak and no pain. It was very exciting.
Nice. Can't even see any mark on your hand now.
Well, Zoom does a lot to cover up imperfections. There's a little mark, but no biggie. I mean, that's pretty good. Close it and open it. It's a good day. Yeah.
Okay.
The kids and I went yesterday we were gone for almost 2 hours. We went out on a bike ride, went exploring, and it was great weather. Instead of being 100 and some degrees, it hasn't been 100 degrees here, but it's been hot and humid like everywhere. But yesterday was perfect. So we went out, rode and it was a great day.
Nice. All right. Any last words? Anything else you'd like to share about the Tavia Vital experience?
I told you at the beginning that if you ask me questions, I'm glad to answer, but don't make me just talk about myself. I'd rather talk about anything else. So yeah.
Yeah. Not many people like doing that. There's some exceptions, but
that's true.
Well, I am so happy you're part of our team. And I know of our patients, all of our clients, they're extremely thrilled that you're part of our team as well and can help them. Beside our Spanish speaking clients, the pregnancy, women going through pregnancy, parents of kids, and patients in general. You got technology skills and really help with a lot of different things. So keep up the great work, Tavia.
I try most days.
So if anybody's interested in setting up a meeting with Tavia or a consultation, please reach out. So I want to thank everyone for joining us today. On behalf of Think Like a Pancreas, the podcast, I'm Gary Scheiner. Have a great rest of your week.